Welcome everybody, and I will start straight away by asking our Chamber President, Colin Ahern, to open today's session.
Thank you, John. It's great to see everyone today. As you know, the Chamber chats are a way for us to meet up and network with each other while acknowledging the current restrictions that we're operating in. It's also an opportunity for us all to hear and learn about important issues and things that are happening in our business community. After months of lockdown, many businesses are now looking forward to reopening and getting back to what they do best. But how ready are we all to reopen? Is it not a simple matter of just opening our doors and seeing what happens? We need to plan staffing requirements, training, stock levels, and a wide range of other logistical issues. Some businesses will have excess stock stacked and stored temporarily wherever they can find space, and some will be employing new staff who don't yet have much experience in the job. These and other challenges can lead to accidents happening, and our speaker today will give some guidance and advice in this regard. I look forward to hearing the presentation, and I hope you find it useful for your business too. I'll hand back to John now to introduce our speaker for today.
Thank you very much, Colin, and it is my pleasure to introduce our speaker, who is Emer Gaffney from Carraig Safety Consultancy. Established in 2007, Carraig Safety Consultancy Limited provide health and safety training and consultancy services throughout Ireland across a wide range of areas. With a track record of excellence and accreditation by QQI and PHECC, which is Pre-Hospital Emergency Care Council, Emer is well positioned to talk to us today about how businesses can return to work safely after lengthy lockdowns. So without any further ado, I'll hand over now to you, Emer, and I'll begin to share the presentation slides. So please feel free to let me know when you want me to move on to the next slide.
Thank you, John, and thank you, Colin. It's a pleasure to be here with you today. It's not my intention to dictate or lecture into how to open your business going forward. I'm here as assistance, and John has already encouraged that you can ask questions, you can put it in the chat. Or if you need to, if something happens after this talk and after this session and you feel I should have asked, you can contact me through email, or if you want to contact John, John can feed the information back and I can go ahead with it and reply back that way. So whatever resource and his assistance, and John is looking to feed that information back to you also. So we are opening up. Some companies and some business industries are further along than others. The hospitality has got a little bit of a delay this week in indoor dining, but there's still aspects of the business that have opened up. Offices are looking to maybe start integrating staff back into the office space come September, and it's just how do we look at that? So the topics that we're going to look at today is staying informed, what our new norm is, that's the big buzzword at the moment. Team members, how do we assist, how do we give them support, hygiene considerations. Well-being is a huge issue with coming back to the workplace. There is a huge amount of social anxieties that people are going to be feeling with the society opening back up again, because by the time it happens, especially if you're looking at September for offices, it's 19 months of probably being in a very small, limited bubble. And then we look at hazards in relation to opening back up, not just COVID hazards, but other safety hazards that we have to consider. Like, has your staff, has their training gone out of date while they've been remote working? Do you need to look at control measures? That sort of stuff is what we'd be focusing on. So staying informed and staying up to date. The first thing you need to do is know your stuff. Familiarize yourself with the industry specific safety guidelines. And these are coming, and only look at the reputable resources. So the HSA, the HSE documents, the Gov back to work documents, all that kind of area. Don't be going into, you know, your kind of clickbait news resources. If you want to find what you have to be focusing on and how the reopening of society is looking for it, that's what I would ask you to focus on. Be sure that you can be ready to address any employee or customer questions, and that you can pivot with the regulations. This pandemic is always evolving, it's always changing, and we're not at the end of it. It'll be a while before we can look back and say, God, you remember when that happened? So we need to keep abreast of what's changing, what talks are happening in the few weeks ahead. Look at the statistics to see kind of, can you get, again, we all know when the government comes out, and that's when we find what the final decision is. But if we look at statistics, if we look at the news trends, if we look at what they're saying, we might be able to for when the official announcements are being made. John, you can just move that on for me a little bit. Just because we're allowed to get back to business does not mean that the virus does not exist. It's still there. And even after opening up, social distancing is going to become a norm, and we need to make sure that employees are following these guidelines. So when we're opening up, we need to look at how we're going to structure the workplace. Is it an office? Is it a hospitality? Is it a restaurant? Is it a hotel? How are we going to restructure it? And how are we going to make sure that we don't have congestion in communal areas? And how are we going to manage that? What do employees feel comfortable for? Like, before, you have employees from an office environment that have been at home since March 2020, and they haven't come back into the workplace yet. So when they left, they would have been having lunch with their work colleagues. You all would have been kind of congregating around your desks. That has changed, and people need to be aware of that, and they need time to adjust to that. And you need to look at them concepts when you're talking about reopening. I would really advise that for anyone that is opening up in the next few weeks or months, or even opening up further, talk to your staff, engage with them now, find out what they think the new workspace is going to look like, and find out what their concerns are going to be when they're coming back in. Also, you have some businesses where you have a limited amount of staff that have been working away in the office while the majority have been at home, and they've gotten used to that little bubble as well, where there could be about maybe 10. And now in September, there's talk of an influx coming in, and their social anxieties might be starting to be raised, and they might be feeling, how is this going to work? So you need to start engaging with staff and start getting their views, how they feel, what you see working, get some feedback from them, and start that process. All right. Create a COVID team. It's very important that you do have a COVID team that is overseeing and managing how everything is working, and have an area like a safe place where if staff feel that they want to discuss certain topics, or they feel that a certain system isn't working, that they have a safe place to go to. All right, so really important to get dedicated COVID team. For small businesses, and you don't have the resources or the staff to have a dedicated COVID team, just have an open forum where you can discuss it, especially in the first few weeks and months of reopening, that staff were all comfortable. Everyone not working together in the same area. So there's various different kind of concepts to this. Hybrid working environment. So maybe you're doing a rota system where some people are home for certain days of the week, some people are coming into work, and that's changing. So you don't have a full influx of staff coming in on the same days. This isn't practical for some businesses, so then you might have segregated breaks, segregated start times. Again, you're just looking at them communal areas. So if a canteen is going to get extremely full at 1 o'clock, well, then maybe certain departments have to start taking their lunches at different times. So that's worked really well with construction sites. Each kind of contractor takes a time period of where they'll use canteen, I suppose, resources and canteen facilities. And that way then we're staggering. It also works well in other industries. So I've been involved in trying to manage, again, the horse industry, where you would have dedicated times. They've been working in this industry for how many years, and your tea time is at 10 o'clock and your lunch time is at 1, and that has never changed, from somebody who's been there 40 years to somebody who's been there 2 years. So it's to try and rethink that and get people kind of used to and open to the idea that break times, finishing times, start times, they may start differing, depending on what area or department of whatever industry you work in. Employees need specific guidelines for how they interact and behave in the workplace post-COVID-19. So most professionals, and I would speak for myself when I say this, I have habits. We all have habits. That's how we all work and run. So where prior to COVID, I would have gone into the office and I would have had my cup of tea, maybe got a bit of breakfast, brought it to my desk, might have had maybe another cup of tea at about 11 o'clock and had my lunch at 1. These things need to be looked at. Can they be broken? Should they be broken? So can anyone see anything wrong with that habit? Can I put that out there to somebody, just as a very basic habit that you have for a work day? Can anyone see that what might be wrong with that post-COVID? John, can I ask you?
Well, yeah, obviously, the situation is very different in many workplaces now to what it used to be. And you've made a number of very valid points there in terms of we're all coming back from having recently got used to working from home, perhaps. And now we're back in with lots of other people. And it's not that you've forgotten, you never forget how to ride a bike and that sort of thing. But I think it's an awareness and an understanding of how other people are feeling, perhaps too, in the whole space, because the headspace piece and how it's affecting our mental health differs from person to person.
Yeah, that's it. So so if I was to take that habit that I have and I was to put that into a post-COVID environment, all right, you should have segregated kind of eating areas and you should have them separate to your workspaces. I'm not saying you can't take a cup of tea to your desk, but you should definitely have segregated work areas. Also, some offices are going to make it mandatory that you have to keep your mask on, whether you're sitting at your desk or you're moving around. Some other workplaces might think, we actually don't need to be that excessive because our numbers are quite low. We're very spaced out. We have 2 meters plus between desks. So that isn't a control measure that we need. But if you have that you are closer and then I'm bringing, whether it be my lunch or whatever to my desk, well, then my period of me not wearing my mask in a work area where I'm in close contact with people has now been extended. So when you're talking about COVID, it's not these big risk control measures you're looking to put in place. They're small, they're minor, they're more habit related for individuals rather than bringing in what we would normally consider for health and safety being equipment, machinery, maybe spending money on it. COVID is all down to our habits and our high touch points. That's the big thing we need to get used to. I don't like this new norm. I would hope eventually we would get some aspect of our old normality back. But we do have this post-COVID where personal habits are extremely important, and we need to make sure that they're suitable for coming back to the workplace post-COVID. Does that make sense? Okay, you can move on. Keep it clean. So the health of your customers, employees, obviously is in your hands. It's really, really important that there's relevant signage around workplaces. So again, this is something that you might need to discuss with staff that haven't been back in the office or back in their workplace since March 2020. All of a sudden, they're going to come in and they're going to see decals on the floors saying remember your 2-meter rule. They're going to see posters, and COVID are these kind of very bright fluorescent yellow posters, and they're going to be advising you to wash your hands, your etiquette if you're not well. And again, we can't belittle that might be intimidating, or you could be used to it and you could be fine with it. It mightn't have any impact on you at all. But for other individuals, that could be very intimidating for them to come back to that. Also, you could be coming back to areas on desks being marked with tape saying that this desk can't be used. You could have additional spray around saying that when you move away from your desk, please ensure that you wipe and clean it. You could have the perspex dividers between. So there's a huge range of what companies can do to keep safe. And they're all going to be different, and every company is going to adapt to what suits them personally. And again, money and resources and financial stuff has to be taken into consideration. So every company is going to adapt as best as they can, but we need to ensure that we're taking into consideration that employees may feel a little bit overwhelmed, and that discussion has to happen. We can tell people to wash their hands, but there's also training that has to be done with that as well. And I'm not saying they have to get training for washing their hands, but we do have to have, when we're reopening, looking at this hygiene induction. So staff need to, so like you would have had a health and safety induction, you now need to inform staff what changes have been done and what we need to look at in relation to the hygiene practices around work. In that induction, you're going to have to look at sick policies. What do employees need to do and what should they expect happen if they're unwell? Before COVID, if I had a sniffle, if I had the flu, I would have gone straight into work and I just would have got on with my day. That can't happen. So employees need to feel safe that they're able to call in sick if they're not well, and they need to know what channels that they have to follow. And all of that should be in an induction for reopening your business and advising them what it is. So the other day, for example, it was like a little bit of a sinus. I know exactly what it was from. I was literally moving bedrooms around with the children over the weekend and the dust just got to me. But I went to go on site there then on Monday, and I felt that my sinuses were at me, but it wasn't too bad. But then when I went and my temperature was taken, my temperature was showing that it was a little bit high. So obviously I had to turn. I wouldn't have went if I'd have even realized that. But I obviously had to turn around and come home. But within a few hours, I was fine again, and I didn't have a temperature, and I checked it myself. So again, you need your staff and your employees and your team, whatever way you want to phrase them, they have to feel comfortable that should that happen, that there won't be any repercussions for them. Is that okay? Your touch points, you need to make sure you have to clean your high touch surface points. That could be that you need to hire a cleaner to do that. And there, again, depending on your resources, depending on the size of your business, there is some businesses that it's somebody's role as a COVID compliance team, that they are regularly, daily going around and cleaning the high touch points. Some other companies are just making sure that there is disinfectant, that there is bins, that there is gloves, and that there is spray that you can use, and that you can clean them down as you're finished. Again, look at what your risk is and decide what would suit best. And you can go from the extreme of having someone employed to do it, or that the facilities are there for staff to do it themselves. Make sure that you have warm water and soap, and make sure that you have enough hand sanitizer for reopening, and that you always have a supply of it in the background as well. You shouldn't get to a stage where you're running out. It should be regularly available for staff. And if people are moving around, they should always wear their masks at the moment. There's a little bit of guidance that's coming in. For example, I won't mention the name, but I'm working on a multinational site at the moment, and they're looking at maybe from September onwards, bringing in that when you're outside, that they're not going to expect you to wear the masks anymore, but inside they're mandatory, whether you're sitting at your desk or whether you're walking around the communal areas. Again, it's down to what your risk assessment deems appropriate. Is that okay? Okay, so firstly, you need to redefine what a modern workspace looks like. Have that talk with the staff. You might want to take a little bit of a video and take that video and do that little tour and show them what their new office space looks like. Or you can just have it in general conversation. You need to consult with each member of your team. Now, I'm not saying that for Roisin or John, for their workspaces, that they have to consult with every member, but devise a team up and make sure that every employee, that team could be 3, it could be 20, depending on how big the company is, but make sure that every member of staff is spoken to before that they come back, and make sure that you ask them how they feel, what their concerns are, and you explain what is expected of them. So are they going to have to do another reinduction? Is there training for manual handling, first aid, whatever course out of date? Their last workspace, are they still on that desk? Are they still beside that certain team member? Have they been moved somewhere else due to social? A one-way system into the building? Is there time staggered for different teams or different floors? All of this sort of, I suppose, ideas and concepts for the new workspace has to be discussed, has to be decided, and then you need to consult with each member of staff and fill them in for it. Find out what worked for them and what didn't while they're working from home. That's really important, because this hybrid working is not going away anytime soon. You're going to want, I'm sure most people, where possible, they're going to do a home kind of ratio to office ratio. But also some people that are coming back into the workplace full time, if they're sick, it doesn't mean that necessarily they have to stop working. If you have it set up that they can work remotely, they could still continue on their day, but just from a control measure in infectious diseases, they're not spreading any illness around the office. The last 12 months has really, really brought into focus people's health and their mental health, and conversation should be had and encouraged around that. And you want to look at what facilities you can put in place as an organization. And obviously the size of your organization will determine what resources are there. But it can be as simple as having a virtual coffee morning once a month. It doesn't have to be that you're bringing in consultants. It doesn't have to be that you're assigning everybody to a VHI kind of mental, and I'm just using these as an example, by the way, mental well-being focus group. If you just have a virtual coffee morning where people are just getting around and discussing how they're feeling, getting back to work, and that continues, I would strongly advise even that. You need to approach everybody with empathy. All right, I might be very tough, and COVID hasn't really got. Now, I don't think anyone can say COVID hasn't gotten to anybody. I know myself, I would find that I'm a very bubbly individual. February was a very difficult month for me with COVID. I struggled badly with it, but then I snapped out of it. Other people have struggled for the whole term of it. So you need to have empathy, and you need to understand that everybody's circumstances are different. You could have family members that are very, very, they could have medical conditions, and even though the vaccines are still rolling out, them concerned that, God, there's new variants coming, and what if the vaccines don't work? And, they still want to keep their little bubble and maybe not mix more as socially as other people. And that has to be accommodated for. So if I came back and I felt uncomfortable, is there another area we put into? Can accommodations be made? Could I be reduced in my days on the workplace? So just look at options that help suit and keep people's mental health in a good place. Safety procedures to consider. I'm not going too fast for anybody, am I? No, okay, perfect. Does anyone want me to stop and answer some questions before I move forward? Or will I do it at the end, John?
Maybe if you go through your presentation first, and then we'll do the questions at the end. There is Noel has put in a question in the chat, but that can wait, I think, till later in the end.
Perfect. So safety procedures to consider. Ensure that there are safety procedures fully in place, okay, and make sure that you have the hygiene materials and the training. So we've discussed a little bit of training, like, you know, does anyone have to do a COVID compliance course? Staff should be inducted on hygiene procedures. That's really, really important. Staff should be inducted on any new policies and procedures that have come out due to COVID. Are we fully aware that they are? And if we're saying that we have something in place, or we're saying that we're working a certain way, are they adequate, and are people actually doing what they're supposed to be doing? What is your refresher training like? Again, has your manual handling gone out of date? It's been, you know, there will be 19 months of a period before some people are back on work. Have you still got your first aiders? Is your fire marshal or your fire safety training done? Have your extinguishers been checked since you've closed your offices? Has your safety statement been updated? All of these things that we haven't thought about because we haven't been in the workplace needs to be re-looked at, and you need to see, have they been done? There's other HR issues as well that I won't get into in too much detail, but again, are contracts in order? Does anybody need any kind of assistance? Is there anyone that's coming back in, maybe with a medical condition that they didn't have before COVID, and we have to look at that. Electrical risks, again, you know, if your business has been closed for 12 to 19 month period, has someone come in to check that the electrics and the plumbing are all in order before we turn back on? All right. Has somebody gone in and signed off that? Now, you could have a facilities team that have to do that. You could be renting an office, and it could be the owner, or, you know, whoever's renting it to you that would need to check it. But again, if nobody has been physically in that building, these are things that you have to look for before you open the doors and you just bring everybody back. There's a huge thing with offices at the moment with mold and Legionella risks. Has the water tanks been flushed? Is the, you know, none of this has been used, so therefore we're increasing them risks now when we open back up. So you need to make sure that you flush your water pipes by running them until the temperature is constant. Clean out any drinking water outlets and disinfect them or replace them. All right, it's really, really important. And again, ensure that anything that has any water kind of area, that you're flushing it out and that you're running it. Deep clean. So in other words, when we're opening, again, that we're not just coming back in after leaving the building and dust and all sorts has built up, or maybe somebody's been running in and out, but the place hasn't been properly cleaned. So all buildings that have been unoccupied, it is possible that you have vermin. It is possible that, you know, in the current heat, there might be insect infestations. You need to get in and you need to ensure that there's a really, really deep clean done. Even if that's not the case, your building should have a deep clean just to give employees the comfort that they're coming back into a safe workplace. First aid, in the event of a first aider being required to carry out their duties if somebody was injured or that there was an illness, it may not always be possible to ensure that there is that 2 meter distance. So have you got the correct PPE in place for a first aider? So now what you need to look at is not only is your first aid kits up to date, and ensure as well when you're going back into the office that you check all your expiry dates and everything in your first aid kits, but you need to make sure that you have additional PPE for them. So they need face masks, they need full aprons with sleeves on them. You need face masks available for the injured or the person who's unwell. You need to ensure that you have plenty supply of gloves, and you need to ensure that there's disinfectant available for them as well, and towels to wipe up if needs be. So all of that has to be looked at. Just summing up, I suppose, as I said at the start of it, we're not past this pandemic era. we've a bit of a way to go, and we need to look at how we're going to move forward. We can't constantly be looking backwards, but look at the opportunities that your business has, and maybe look at what you can, like, instead of using this as an exercise of, oh my God, I have all this to do. Maybe there's ways of improving how you do things, and you're going to use this exercise to help you do that. So for example, for ourselves, because of COVID, a lot of training courses, even for my, like, for giving them to my own staff, it's all gone e-learning, that kind of way. So I would be looking at not having classroom environment for the inductions, and people can do them in their own time. We're not trying to get people in one place at a certain time, and the logistics of that. So there's ways of, even though as difficult as COVID has been, there is ways of maybe using it as a tool to relook at how your business model is and how you deal with staff, and maybe see it as a way of, I can actually use this as a tool to improve that. And I didn't have a great well-being section before. We did briefly talk about it, but I'm going to focus on that now, opening back up. So I would use as a tool as how to bring your business forward into this new kind of world that we're in, and what can you do to make your business better, and move forward. And as things change and as things evolve over the next 12 to 18 months, that we're in a position that we can move easily with it, rather than it always being a shackle tied to us. Is that okay?
Fantastic, Emer. That's really, really good. A great whistle-stop tour of some
Really
of
use a whistle stop.
some of the things that all of us in businesses, and it doesn't matter what type of business it is, it's all about people gathering in organized fashions to work together, and we need to kind of be mindful of the safety aspect, really, which is what you've been outlining there. And thanks very much to Noel. We have a question in the chat box, which Noel put in there. Do you think, Emer, that it's important for each team to be included in the conversations around how we implement these new changes, for example, check-ins and things like that? And I guess what you're getting at there, Noel, is that it's not good enough just for the boss to say, here's the new way of doing things, now just do it. You need to get engagement by everybody.
I really do, and I think I was hoping that message was getting across. Obviously management have to take the decision that we need to do this, and we're bringing this in, but there has to be an engagement process with staff to get them on board with it as well. And if it's a case that it's a mandatory change that has to be brought in, and regardless of, I suppose, the rest of the team's feelings on it, if you engage with them, you can bring them, they'll buy into it quicker than just being dictated to. So if it was a mandatory change, I would be saying, look, we have to bring this in, but this is the reason as to why we're bringing it in, and this is the benefit that it's going to be in the long run. So it's we want to engage with them and we want to get their feedback, but there is some stuff where health and safety and for COVID precautions that they are mandatory, but it's to bring them in and explain it, rather than just being like, this is how we're doing it, and I don't want anyone back, give me any back cheek for it. This is it, and if you don't do it, just approach it that way. I wouldn't encourage it anyway.
Super. And Noel, I see you have your hand up there. Have you got your microphone on?
Only purely because, Emer, I just wanted to say I actually jumped the fence early, and I had my question in before you went on to the slide about that, so I did get it. Problem. Yeah, but thanks.
Very good. And Lara, thanks very much for the advice to check the fridge. But you have a question there, Lara. What is Emer's position on employers requiring that only fully vaccinated staff return to the office and workspace? And indeed, that's a complex question, because there's a safety aspect to that, obviously, but there's also, the legality in the workplace, HR kind of aspect as well. But would you like to give us a few words on that particular aspect of things?
It's a safety and a HR one. It's quite a loaded question. I suppose from an employer's point of view, they would need to look at their whole workforce. And if they had people that were coming in that were quite vulnerable categories, they may need to look and say, well, actually, from a risk control and a control measure point of view, that we only want fully vaccinated staff back in. It's again, like I said, it's ever evolving, it's ever changing. People are going to be very cautious when they're opening the doors. They could feel like that for like now until maybe December, and then things could change then dramatically in 2022. So if employers are making that decision, I'm sure they're making that based on the protection of their whole workforce rather than trying to signal people out. That would be my thinking of it anyway.
Yeah, very good. Yeah, no, as you say, it is a complex question. It's not just a safety issue, it's people's rights and entitlements, it's discriminatory, it's all this sort of thing. Those kind of questions bounce in there as well.
But you do to look at the protection of the whole workplace and your workforce. And if there is risk factors there, that could be a huge reasoning behind it.
You mentioned first aid as well in your presentation, and in that regard, is it imperative that employers provide additional training for staff in that area, or what do they need to do?
Encouraged, it's not mandatory, but it is encouraged that they do a kind of brief 2-hour session of just safe control measures in relation to carrying out your duties for first aid, in relation to kind of protecting you and the individual who you're actually providing the first aid treatment to. So what that kind of 2-hour session would go through is just, you know, how to protect yourself, how to protect the rest of the team, and doffing correctly, kind of things like that. And it is highly recommended, but it's not mandatory.
Very good. And then in relation to contact tracing, and this is becoming something that we're hearing a lot about in the media, and that how much onus is on a business owner in that regard?
It's very important that when you do open up that you look at contact tracing. It's the only way that the HSE can control if there is an outbreak and get the information that they need to get close contacts. So when you're reopening, anyone who's coming into the business has to look at some sort of signing in and signing out, or definitely signing in. Now that could be just various different ways that companies are looking. It can be QR codes, it can be security badges, it could be that you're doing it remotely from a Google Doc. Or that there's a pen and a sign-in book, but there's antiseptic wipes and bins for people to wipe the pen before use. So it's as simple as that to a little bit more complex, but it is important that there is an adequate contact tracing system in place.
Super. Okay. And then, you know, even if we do everything that you've said there today, we do our best to make the place as safe as possible, accidents still will happen.
Yeah.
And I suppose we need to know or advise business owners then in terms of what they need to have in readiness in the event of an accident happening. In other words, you know, do you have a view on incident or accident registers, staff training on what to do in the event of an accident, notifying your insurance company if an incident occurs, that sort of thing? What's your take on that, or what advice would you give?
So just for the general incidents and accidents that's outside of COVID, it would be the same as what you would have done before. So accident report forms are very important to be filled out, and they should be filled out very quickly after the incident or the accident has occurred, because generally speaking, if you do it 2-3 days later, your mind starts remembering things differently. So it's very important that it's done as soon as the incident, or as close to the incident occurred. You do need to notify your insurance companies. Again, any delay on that can have an impact on the claim, should a claim arise from it. And then I would always say, when somebody does injure or they have an illness in work, follow it up and see what could be done. Like, what's the root cause of it? Can we change something to stop this from happening again? Or am I just checking in with somebody to say, look, this happened to you a few weeks ago, I just want to make sure you're okay. Are we closing it off? And so it's all well and good writing up a report, but you also have to close off the report. So was there anything that could have been done differently, or was it just an accident that happened and the control measures you had in place were fine. It was just something that was uncontrollable. But you need to prove that you have gone back on that and that you've looked at it and you've closed it off.
You're on mute, John.
I forgot my mute my button. I've one final question. I'm just watching the time there. Lara has sent in another question, and it is something quite topical with us all considering going back to the workplace. Recent research has determined that the virus is a lot more airborne rather than getting spread on surfaces and that. So that raises a question about air conditioning in an office and air circulation. What is your take on that, Emer? And I see we've a question from Colin, so I'll hand over to Colin after you've answered that. So what do you think in that regard?
There's just devices that you can get for open plan offices. And again, it can be as simple as like even the Dyson, the Dyson air purifier, they have apps that can go onto computers that can kind of tell you that if the air quality is low and you need to open windows and things like that. Air conditioning units, most offices, and you can check this with your management companies, but most offices now have a filtration system in them that is cleaning the air as the air conditioning is working. So it's safe. So this has already been addressed with businesses that have been opened. But if you're any way concerned, you can go and you can talk to the management company and you can just get that signed off. Or you can have, like I said, additional devices, like just things like, home appliances that will work to more expensive industrial units that, again, they're cleaning the air throughout the day. The most important thing though is, even when you are indoors, is ventilation. Windows have to be open, doors have to be open. Now I know some offices don't have windows, but doors should be open and you should be having good ventilation coming in. So regardless of whether you're indoors or outdoors, especially indoors, ventilation is extremely important. So I didn't say that in the talk, apologies, but it is one thing that you have to ensure that you have good ventilation coming in and out of the office.
Super, thanks very much, Emer. So what I'll ask now, I'll ask our President, Colin Ahern, to come in and wrap us all up. I think you have a question as well there, Colin, so I'll hand over to you.
Thanks, John. Thanks, Emer. Look, I have two very brief questions. In terms of COVID and the management of the COVID regulations in your business, is there, like, for example, do the HSA have any authority to monitor how a business is managing it, or is there another regulatory body that watches?
There's not, to be honest. The HSA or the HSE, they put out guidelines and there is packs on the sites that can kind of give you a bit of a checklist. Are you doing this? And if anybody needs them, I can email them over, but they don't come in and monitor. There's not like saying that you have done, like, you're scoring 90% in this. Okay. Now we do COVID audits, Carraig Safety, and we give a percentage, but that's more of a private company that's doing it rather than a government body. So we've gone into some companies and we've done just COVID audits, so see what their COVID control measures are, and then they get a risk rating as to where they stand, and they get advice as to how to improve that risk rating. Or it could be that they're scoring in the 90s and there's nothing further that they can actually do, but they're just getting the peace of mind that they have everything in place for their staff.
Thanks. Thank you. And the other thing I wanted to ask is, in terms of accidents in the workplace, and you spoke about accident report forms and logs and whatever the case might be, like, is there, and I'll give an example. We had in my business, we had an incident the other day where a waiter dropped a pot of tea on themselves on their leg. Now, it's not boiling water as if it just came off a pot, but it's definitely caused discomfort, and they were out of work for a couple of days. Now, my health and safety representative in the hotel, his advice would be to contact the HSA and report a workplace accident if it results in the employee being out of work for any length of time. Is that what your advice would be, or is there a rule of thumb, or is there something other than, I suppose, you know, is there something that gives very clear instruction with regard to that?
The HSA clearly state that if you're 3 days out of work, that the accident has to be reported. And that's very clear guidance. And you can do that online. You can log in and you can do that online with them. And that 3-day includes Saturdays and Sundays if their shift would normally cover Saturdays and Sundays. So some people go, oh, it's the weekend, so I don't have to report it. But if you would normally work on a Saturday or Sunday, then that includes them days as well. So 3 days is the rule of thumb, Colin. Okay.
Super. So look, I hope if anyone else has any questions, as Emer said, please send them through and we'll forward them on to her. But I just like to thank Emer for the excellent presentation today and for answering all our questions. It was hugely informative and relevant. And as John mentioned as well, accidents don't happen, they're caused. And whatever one's perspective might be, it is clear that many unnecessary accidents and incidents happen in our workplace can be avoided by proactively managing the risks as outlined by Emer today with regard to COVID and non-COVID incidents. So thank you very much for your words of advice in your presentation today, Emer.
Thanks so much.
No problem. The Kilkenny Chamber, as always, is a supportive and representative organisation for our members. We have a huge and very proactive lobbying voice, which we are using to guide and influence government and others in all aspects of running our country at the moment. Currently, the focus is very much on reopening our businesses and the country's economy, and the Chamber has been engaging weekly with the government, seeking timelines for sustainable reopening, sustained financial support, and supports for towns and cities. Our work in this area is relentless, and we are ensuring that the voice of businesses in Kilkenny is heard loud and clear. Today's Chamber Chat is a small but important part of what we do, and we are always interested in hearing from our members about what else we can do to assist you in these challenging times. Please also keep an eye for our weekly newsletter for information and updates on future news and events on an ongoing basis. And thank you for joining us today. Stay safe and continued success to you and your businesses.